Good morning. This is Kavita from Sarnathan College of Engineering, Trichy. Here we are going to discuss on the topic called as cryogenics in medical applications. Cryogenics is the science of dealing with very low temperatures. Very low temperature is actually absolute 0 degree Kelvin, whereas the cryogenic temperature is going to deal below 120 degree Kelvin. And the substances used to create the cryogenic temperature are called as cryogenic liquids. Example, liquid nitrogen, liquid helium and CO2. Cryogenic liquids are formed by super freezing the permanent gases to liquid states. That is, by cooling oxygen, nitrogen, hydrogen and helium, we are going to create the cryogenic liquids which are going to offer extreme low temperature. Out of this, liquid nitrogen is most easily available and liquid helium can produce the lowest temperature. The devices used to create cryogenic temperatures are going to be called as cryocoolers, whereas the cryostats are the devices used to maintain an object at extreme low temperature. The different types of cryocoolers are Joule-Thomson cooler, Brighton cooler, Stirling, pulse tube cooler, Gifford-McMahon cooler. And the cryogenic is mostly used in material sciences, but here we are going to discuss the applications of cryogenics in medical field. Cryogenics can be used for therapeutic purpose as well as the surgical purpose as well as for preservation. Based on this, it is classified as cryotherapy, cryosurgery and cryopreservation. In cryosurgery, there is a subterm called as cryoablation. Cryotherapy, we are going to use the extreme low temperature for therapeutic cure. By using extreme low temperature, the effects are going to be reduction in cell growth and reduction in metabolic rate, and which is going to increase the cell survival, and it decreases the inflammation, decreases pain and promote the constriction of blood vessels. Thereby the blood flowing is going to be stopped. It is going to be of two types, ice pack therapy as well as the whole body therapy. Ice pack therapy means ice pack is packed over injured area and is intended to absorb heat in the vicinity of the injured area. Cold decreases the muscle spindle fiber activity and slows down the nerve conduction velocity. Thereby the pain conduction is going to be reduced. It is used to remove the pain of minor injuries and used to remove muscle soreness. The ice pack therapy is commonly used in sports medicine. Whole body therapy. Here we are going to expose the individuals to extremely cold dry air, that is less than minus 100 degrees Celsius for 2 to 4 minutes. And to achieve this, the sub-zero liquid nitrogen or refrigerated cool air has been used. And this whole body therapy is used to cure multiple sclerosis and pneumatic arthritis. Cryosurgery. Here the surgical process is going to use the cryogenic temperatures. At extreme low temperatures, the ice crystals are going to form inside the cell membrane, which eventually tear the cell membranes apart, and thereby destruction of cells are going to occur. This is used to cure the skin condition like warts, moles, solar sclerosis, small skin cancers, Parkinson's diseases, liver cancer, etc. Cryoablation. This ablation is one form of the surgical procedure. Ablation occurs in tissues that has been frozen at least by 3 mechanisms. Ablation, it is the formation of ice crystal within the cells, thereby destroying the cell membranes and interrupting the cellular metabolism. And second process is going to be the coagulation of blood, thereby interrupting the blood flow to the tissue, in turn causing ischemia and cell death. And third one is going to be the programmed cell death cascade. So prostate and renal cryoablation are the most commonly available application of cryoablation. Cryopreservation and cryoconservation is the process by which cells, tissues and substances susceptible to damage caused by chemical activity or time are preserved by cooling to sub-zero temperatures. Some of the examples are semen preservation. In blood preservation, special cells for transfusion can be separated and can be maintained at extreme low temperature. Similarly, the stem cells and umbilical cord blood can be saved at extreme low temperature. Tissue samples like samples and histological cross-section can be saved, and eggs, embryos can be preserved using cryopreservation. Plant seeds, shoot preservation, etc. can be done at cryopreservation, that is by using the cryogenic temperature. Thank you.